for today, Thursday, May 28th. It is 9 a.m. I know the hour is early, but we wanted to be able to accommodate MDH schedules. I also know that several of our members are engaged in a significant media event. I believe Senator Hayden is having a press conference, and there are members who wanted to watch that press conference. And given the events of the last several days, I just want to acknowledge that their absence here is certainly not as important as their presence there. Given that, I did want to review why we're having this hearing. Testing, tracking, and tracing was of significant concern through the end of session. Now I understand that significant actions are being taken. We heard at the beginning of March that the governor was prioritizing testing, tracking, and tracing, and that MDH was executing that. I believe on or about May 5th, Commissioner Kelly and I had a conversation that a vendor, in fact, and they had a very short list, and so was hoping to get an update on that vendor, what the contract would look like. There was a federal funds request, and I'm going to ask Ms. Strand to send that to the members. There are a number of federal funds that I had the opportunity to review as part of the LAC process, and will help us understand where MDH is going next. And so with that, I see Commissioner Kelly is on. If she could unmute and turn on her video. Hi, good morning. Thank you for making time for us today. So in early March, we did talk about contracting with a vendor, and was wondering where you're at in that process, and when you think a contract will be finalized.
Madam Chair, members of the committee, my name is Margaret Kelly, for the record, and Deputy Commissioner at the Department of Health. And thanks for inviting me here today to talk with you about our progress around case investigation and contact tracing. So as you know, we have additional cases of COVID every day. And we'll be announcing, I think, 400 additional cases today, but we're in the 400 to 700 to 800 range of additional cases every day that require staff to reach out to the individuals and do a case investigation and do some contact tracing. And the capacity for that, we have very limited capacity to do that here at the Department of Health, and we need to bring on additional resources to get that done. So we are currently have about 200 Department of Health employees. Typically, it's a group of maybe 25 or 30 staff who do the case investigation, contact tracing work for any particular outbreak, whether it's a foodborne outbreak or measles or H1N1, but a small group of staff who typically do that. We have reached out across the department and redeployed staff, so we're now at about 200 MDH staff doing this work. We have reached out to other agencies and added a few other state employees to that. We have also brought on board local public health, and local public health has the capacity to add up to 300 plus staff on any given day if we need that. We also have gotten assistance from 2 health plans, Blue Cross Blue Shield and Medica, I believe. So they're offering us about 150 employees between their 2 organizations, volunteering to do the work on behalf of the Department of Health as well. And then we have students from the University of Minnesota Public Health School and Hennepin County Medical Center residents who are volunteering here to complete their curriculum to do this work as well. And that brings us up to about 800 people that we currently have doing this work. And we're thinking we need to get up to somewhere in the range of 1,200 to 1,400 if we're going to do 20,000 tests a day, and assuming a certain positivity rate. So it's an enormous volume of staff to have to manage, and we're looking at two vendors that will assist us with that. And one would be an IT solution that we would layer on top of our current case management software system that would provide us some workflow, some customer relation ability to work with a large workforce doing this work, to manage their time, to help process cases, to keep track of what they're doing and how well they're doing it, and to give us the data analytics we need on what they're doing. Other states have, it's called a customer relation management software package, and other states have purchased a similar package and rolled it out. I think the most visible is Massachusetts, who was one of the first states to stand up an effort of this sort. And so we are in the final stages of talking to, we've talked to a number of vendors. We've narrowed it down to 2 vendors that we are trying to make a final decision on based on what their software has to offer, the level of effort it will take for MDH staff to stand up a package here at the Department of Health. The time commitment, excuse me, the time commitment on our part and the vendor's part, and just doing some due diligence on where they've, who they've contracted with in the past and how that's gone. And we hope to make a decision on that piece of it in the next, within the week, so that we can get going. We anticipate it will take anywhere from 2 to 4 weeks to stand up that software. The other contract vendor that we're looking to pursue, and we've narrowed this down to 2 different vendors as well, and with a possible third, is to someone to manage the personnel side. And that would be to help us to not just to bring on the staff, but to manage the staff as well, in terms of all the work that they're going to do, onboarding the staff, providing the training, scheduling the staff, managing their daily workloads, reporting out the performance metrics, taking calls from the public. And then that vendor would be asked to have the surge staffing capacity. So to the extent that we need more than 800 on a given day, they would be able to staff up, and then they would be able to staff down as well. So that's the status of the 2 major contracts that we're looking at entering into in the next week to 2 weeks.
Thank you. And I did receive the request from MMB for case investigation contact tracing software system, $8 million. Is that for both of these components, or is that a single component?
Madam Chair, that piece is for the technology piece. We wanted to be able to enter into a contract quickly as we are finalizing the negotiations, and that would be for, assuming we would use the coronavirus relief funding stream. Those funds need to be used by December of 2020, and so that would be an estimated cost between now and the end of December for the implementation and the licensing fees as well. There will be ongoing costs into the next fiscal year. As long as we're using this software, we would have licensing fees for anybody accessing the program. And so we are looking at what other funding sources we have if we need to put in another LAC request for other federal funds that may be coming forward to cover ongoing costs into calendar year 2021.
So, Commissioner Kelly, is the vendor aware that there is no plan for funding beyond 12/30 of this year?
Madam Chair, I don't believe we have had conversations with the vendor about we're not at that point in conversations with the vendor, but I believe that what we are estimating is that we would use the funds to pay the costs, to pay some of the costs up front, so it would get us for a period of time.
Okay. Senator Nelson, I see your hand is up.
Oh, yes. Thank you, Madam Chair. My question is not to the contracts, but and if this is not the appropriate time to ask to answer, I'm willing to wait for the answer. But there's just been so much concern, questions about contact tracing, its value, its personal privacy issues, and I just think it would be incredibly helpful, Commissioner, if you or someone from your staff could give us really the ins and outs of contact tracing, why it's important, how does it protect personal privacy, what are people's rights, what could they expect. I just think that's a very important thing. There's so much, as you know, all across our social media world today, where we hear many things in many different arenas, and we just need, I just need to hear from you or your staff, particularly, and I think my constituents do too. Why is this important? How does it pair with testing? Can you do one without the other? And how do you protect people's privacy?
And thank you, Senator Nelson. I should have started out being more clear. Commissioner Kelly has particular contract and financial responsibilities, and Mr. Huff is available. We're going to move to him second, but I wanted to let Commissioner Kelly be able to talk about the contracting and the financial commitment. And then your question is completely on target for what we want to address with Mr. Huff, with Commissioner Huff.
Thank you, Madam Chair. I'll just withdraw until the appropriate testifiers.
And I know he took notes, so maybe in his opening remarks he can help with some of that. So Commissioner Kelly, I do have a concern that you are obligating the state to a financial commitment for which you have no plan beyond December 30th of this year. And I think it's fair that the vendor know that there is no plan for beyond December 30th of this year. If you're at the point of deciding to use federal funds, we also know that the COVID-19 Minnesota Fund is time limited and is in fact being absorbed quickly. And so I understand there might be other federal funds coming, but right now we know what we know now. And if it is your intention to sign a contract that obligates us beyond the funds that you are requesting, then you'll be coming to us asking for a deficiency when we're already facing a deficit. And so I would proceed with a great deal of caution, Commissioner Kelly, and then I'll go to Senator Abler.
Yeah, Madam Chair and members, I appreciate what you're saying, and it's not our intent to obligate the state to sign a contract without identifying the full funding for that contract. And so we're gonna pull that together before we do that, and can let you know what the full funding stream is, whether it's other federal funds we've received or tapping other existing sources we have, but or other federal funds that we anticipate coming down the pipe that we would put together an LAC, but we will have a full funding package for that prior to signing a contract. Just not sure today what it will be.
Thank you, Commissioner Kelly, and Senator Abler, and then Senator Kiffmeyer.
Well, thanks. And I think my question's appropriate for Ms. Kelly. So we're going to have a vendor, and they're going to do something, and they're going to work on tracing people. Can you really talk about the mechanics of what it is they're going to be doing? I'm interested. I read in the paper about New York, and one of the tracers there, they say it's an art and a science, and and they found a guy who'd been exposed, who didn't want to stay home, and they said, well, will the police be stopping by for that? Will this vendor have the authority to call the police on people that don't want to participate, that they think are at risk? Can you kind of talk about that? And then I have a follow-up. So thank you.
Commissioner?
Sure. I will give it a start. I do have a staff person, Chelsea Huntley, on our team who has been working with our epidemiologist and with local public health and others to build out our approach to how we're going to roll out an expanded case management approach. But First off, it's a voluntary activity. And so we will reach out to people, we will call them to conduct an investigation and to do contact tracing, and they are not obligated by law to comply or to answer our calls or to participate in the conversation. The number of people that refuse to participate is really pretty small. It's just a couple percent of the cases that we reach out to that refuse to participate or that we're not able to reach because we don't have contact information or because they just simply don't answer the phone for us. There is no, the only enforcement tool that we have as a state to require people to stay in their home is quarantine. And we are not quarantining anyone at this point in time. We are asking people to voluntarily comply with self-isolation.
Okay.
Senator Abler?
Madam Chair, yeah, thanks. So our program is different than New York's. It sounds like New York has a lot of teeth, and I think it sounds like they were trying to be sort of voluntary, but then they're going to drop the hammer. So I'm just concerned about that. I'm expressing it now, and going forward, people, there's this herd idea. We got to protect everybody, and I respect that to an extent. But people still have rights, and I hope that we keep that in mind. And so at least I'll just sound that. And then to my other one, which I think is still for you, there was a bill that we had before about contact tracing and 4,000 people and money and all of that. Do you need any law at all, any new law to set this up? Or can you do it all by yourself, at least in the meantime, between now and the end of December, drawing from the governor's COVID money and using your own authority now? If we don't do anything, you can do this no matter what we say. That's my question.
Commissioner Kelly.
Madam Chair and Senator Abler, we do case investigation and contact tracing for any outbreak that happens now, whether it's a foodborne outbreak or other infectious disease, measles, or anything. So we have authority in law to do this work. It is voluntary. There is no requirement that people participate. And what we're talking about here is needing to do a greater volume of that than we have ever done before, and needing additional resources to provide that capacity for us to do the work we have always done.
All right. And Madam Chair, my last question, and you
Senator
I have many more. I'm trying to self-edit here.
I know.
If I can just think of how to say it. Let me just let somebody else, and I'll come back just to be fair.
Okay, thank you. And members, I'd like to at 9:30 be completed with questions for Commissioner Kelly and move to Mr. Huff, so we're respectful of individuals' time. I have Senator Kiffmeyer on my list next.
Thank you, Madam Chair. Commissioner Kelly, my question has to do with the money side of it. I think I heard you say, and I just want to have you clarify it, you have this money until the end of December, but I also thought I heard you say that that would allow you to prepay so that you could go into January, February, or over that. So you would basically use that money and prepay. Now, maybe that isn't quite what you said. I'm asking this so that we can be clear about that money, and it's available to the end of December. So can you clarify in regards to doing something like prepaying so you can continue into January, February?
Commissioner Kelly.
Madam Chair, Senator Kiffmeyer, thank you. We are looking at the availability of the funds, and I believe that the coronavirus relief funds need to be expended by the state, either obligated or expended by December of 2020. And so we will, as we negotiate the contract with the vendor, we're anticipating that we would be able to expend the full $8 million, I believe is what the request is for, that we would be able to expend that full $8 million by December 20th. And there will be additional costs we anticipate needing this system to be up and running for at least 12 months and maybe longer. And so there will be additional costs that we are looking right now at other sources of funding that we have available to us from the federal government or from available to the state that we may need to tap. And so we will put together a full funding package prior to signing that contract so that we do know what we have of it, that we will be able to meet the obligations that we are.
Follow to that.
Senator Kiffmeyer.
Thank you, Madam Chair. So, Commissioner, when I hear that, though, and I also hear about other pots of money that are available to you, federal and so on, the one thing we know that contact tracing isn't the only need right now. There's going to be a severe reduction in the Minnesota state budget. And for HHS committee, my concern is, where are you going to go to get that additional money? Could you give us just a general list of what kind of pots of money, as you call it, that you would go to that would be available to you, you feel? What are those pots of money that you would go to?
Commissioner Kelly.
Sure. So, Madam Chair and members, you all appropriated $21 million to the public health emergency or public health contingency response account back in, I believe it was February of this year.
Yes.
That is a general fund source that went into that contingency account. In addition to that, we have received from the various federal CARES bills, an additional 21 million of federal resources. And so we have been prioritizing our spending onto the federal resources. We are looking to see how much we anticipate we are going to spend over the next 12 months on this response to see if we are going to, how much of those federal grants we are going to draw down and the extent to which we're going to tap into the public health contingency response account so that we know how we can meet the obligations of the contract we're entering into. We're doing that work now.
And Commissioner Kelly, I think Senator Kiffmeyer and I are both concerned that there would be an obligation made to an external party that would require future general fund or healthcare access fund resources. And so it would be best if we were aware of that before any sort of commitments were made. And if I remember correctly, the funds that were transferred out of the general fund into the emergency account have an expiration date and require that federal funds be used first. And so we'll be paying attention to the order in which funds are used. I see Senator Abler's hand just went up. Senator Kiffmeyer, did you have any further questions?
I'll save it for Mr. Huff.
Thank you. And Commissioner Kelly, as far as the information that's being collected on Minnesotans, yes, it is voluntary. Will they get informed consent or simply a Tennyson warning? Because I think there's some confusion that if you you can have a test and get the results as either positive or negative without necessarily participating in a contact tracing program. Will that be clear to people? Is the vendor being trained to respect that inherent right of Minnesotans?
Madam Chair, yes. The terms of the contract would be that any privacy, the data privacy and how we communicate with individuals when we call them, the way that it's being handled now would be required of any individual hired by the vendor, required by the vendor itself, and then by the individuals hired by the vendor.
Thank you. And Commissioner Kelly, what will happen to the data that you collect? Because one of the things we've become aware of is that, for example, the Google Health Analytics sector of Google is very interested in health records data. So will the vendor contract require that the data be retained for MDH purposes only, not shared externally? Is there a timeline for its retention destruction. If somebody is a negative test, are they treated differently than a positive test? So I guess some of those concerns might be raised with Mr. Huff, but as far as the contract goes, is that being structured into both the IT contract and the people management contract?
Madam Chair, yes. So the information that is collected during a case investigation is stored within the Department of Health's data, Minnesota Meds disease surveillance system. We have a disease surveillance system that will be the system of record, and the data will be stored there. It will be entered into that system and only be used by the Department of Health. I mean, it will be accessed, the records will be accessed by the people conducting the investigation, but it will be pulled out of and go back into that system. So it is not shared with anyone. If there were a Google Analytics or, you hear of these mobile apps that could be used in contact tracing, that would not be tied in any way to our database. And that would be something that people could choose to use if they wanted to download an app to do that, but it would not be tied in any way to our database.
Thank you. And Senator Abler, last question, then we're going to let Commissioner Kelly get on with her busy day.
Yeah, and Madam Chair, I think this has been a really good discussion, and Commissioner Kelly, I appreciate what you're doing. There's been a lot of things that have been learned since this whole thing started over in Wuhan or wherever. Do you see the contact tracing evolving as well? Clearly the problem in Minnesota is long-term care, congregate facilities, and people with really bad health problems, and the other people are just hardly at risk whatsoever. Are you considering focusing more on that, since that's where the problems really are, as you kind of focus on with your limited resources?
Commissioner Kelly?
Sure, Madam Chair, if you don't mind, I actually would like to ask Chelsea Huntley from our team if she could talk a little bit about how we are trying to do some more upstream work with case investigation, given the nature of where we're seeing outbreaks and the communities in which we're seeing the outbreaks, and how we hope to work more closely with local public health and with those communities to reach out to folks so that they understand what their risks are. And I see that Chelsea has joined, and if I could ask her to comment for a minute.
Chelsea, and then we'll go to Senator Rosen. And thank you, Commissioner Kelly. Chelsea, Ms. Huntley, welcome.
Great, Madam Chair, members of the committee, thank you. Yes, working to direct our resources to those high. As someone gets of case, one of the first questions they get asked is, are they a healthcare worker? Do they live in a setting where there are multiple folks living, etc.? And that information is then prioritized within the MDH structure to work with those organizations and those facilities to put plans in place to stop that spread. And so this structure of case investigation and contact tracing to prioritize our resources there while we continue to give the information that they need to isolate and stop the spread in terms of their family, friends, social contacts.
Madam Chair, just fine.
Senator Abler?
We don't have time to get into it, but that answer wasn't really as satisfying as I was hoping for. The long-term care side is a virtual disaster in terms of the foresight, the enactment of activities to protect against it, and the focus on areas that have minimal or no risk, compared to Walmart, and the public at large, which are virtually at no risk of dying, a tiny, tiny risk for the random 40-year-old or 20-year-old or something. So I hope that I'll just make it a statement, and I hope that as we move forward, that we focus on where the problems are. We're not going to be able to contact trace everybody. People aren't going to stay home in case they touch something, which is now not even a problem. So I'm concerned about the focus, and I'm really concerned about the outcomes, where we still are having lots of deaths in nursing homes and facilities, which is really where all the hands should be on. So I'll leave it at that. Thank you, Madam Chair.
Thank you, Senator Abler. And I did want to note, Senator Housley asked to join today so that she could be a little more engaged on this part of the testing. She has been doing a lot of work in long-term care, Karen, and has some plans for next week as we learn more about how infection is being spread in long-term care facilities. Our role with oversight of MDH and hers with particular interest in long-term care do have intersection here. So Senator Rosen.
Thank you, Madam Chair. I'm very much looking forward to Senator Housley's hearing next week. We need some answers from that. But I do want to focus on the financial part of this. And perhaps I missed something. I had to catch a phone call. I just want to make sure that everybody understands that the original $200 million we gave the governor of the COVID Minnesota Fund, there's only $18 million left of that. So the House has appropriated in there, they passed a bill for contract tracing. And stop me if you've already covered this, Madam Chair, but they have $300 million appropriated, $3 million for short-term staffing, $4 million for transfer to tribal nations, $30 million for local health departments and community health boards, $5 million for public information campaign, and $30 million for information technology, and $228 million for temporary employees. That's $300 million. We do not have that appropriated out of the CRF, the Coronavirus Relief Fund. That is still a bill that we feel the Senate, that legislature should be in charge of. And so I'm questioning, how is this going to be paid for if there's no agreement from the Senate, of the House, or the governor on where these funds are going to be taken from? And if we do have, and if you wouldn't mind indulging me again, Madam Chair, if there is federal funds that are going to be supplanting this contract tracing dollars.
Commissioner Kelly, if you could briefly review, our finance chair did have other obligations this morning, so I'm glad that she is here. But Commissioner Kelly, if you could address that for Senator Rosen.
Thank you.
Sure. So, Madam Chair and Senator Rosen, the request that we have put forward from the Coronavirus Relief Fund for $8 million is a piece of that $30 million that you referenced in the House bill for technology. At the time that we started talking about this whole budget, we thought we might need $30 million. I think that the total cost will be in the 10 to 15 million range, maybe 17 million tops, depending on how long we're using a software package for. And so we think that the Coronavirus Relief Fund dollars need to be expended by December of 2020. And we think that of that total cost, we could expend $8 million by December of 2020. But as I said to the chair and Senator Kithmeyer, we are looking to see across our federal funding sources that have come directly to the Department of Health out of the federal multiple federal bills, how we would piece together the total 12 to $17 million cost over the period of 2 years year and a half to 2 years that we may need to use the software package. So we will have that figured out when we enter the contract. The other pieces that you mentioned in the House bill are still things we are working on. We still do have a short-term staffing request that we will need to put forward out of probably the Coronavirus Relief Fund as well. The longer-term staffing solution will also need to be addressed, and that will probably exceed the December timeframe. And so we're working with MMB on how we could piece that together. That was the big 200+ million budget that we had estimated about a month ago, and I I don't anticipate it will come near that. That was assuming that we would be hiring up to 4,200 people to do case investigation, contact tracing, and now our estimate is closer to what we originally thought in the 1,200 to 1,400 range. And so that price tag will come down significantly. There were a few other elements. I don't recall what they all were right now, but we're working with MMB to identify how we can, across the different sources of funding, get that paid for within the time constraints of the grants.
Thank
And
you.
Madam Chair,
Senator Rosen.
Thank you, Madam Chair. Commissioner Kelly, the transfer of tribal nations, 4 million.
Yes, so Madam Chair and Senator Rosen, we are working with tribal governments and local public health to understand their funding needs as we move forward in this area. And I think those costs will actually go up than what we earlier anticipated because of the nature of the work that we are partnering with local public health to do around long-term care, around outbreaks at food processing plants or within community settings, the case management work, the community intervention work. And so I think we had thought maybe $20 million for local public health, and it's looking like it may be more in the $40 million range. And we're, I think, reaching out to tribal governments to see if the $4 to $5 million estimate will be sufficient for them as well, given the nature of the work that we're asking them to do. And the biggest piece is around the supportive services and the wraparound services when we identify positive cases in the community.
Thank you. And Senator Rosen.
Just an ever moving target here on these expenditures. So thank you very much.
Thank you. And members, to that point, there are some federal funds requests that are in your inbox. Please review them. We have had great interest in different kinds of testing, and in particular, MDH is starting to do serological testing, so we'll have some sense of where this virus has been. But as you look through the checklist, it will help inform you as we're going to be facing budget decisions next year. If the department is committing us when we don't have designated funds, we're going to face some uphill challenges. Commissioner Kelly, actually, I'll save this question for Mr. Huff. It's about the law enforcement data sharing. Is there anything else, Commissioner, that you would like us to know before we let you continue with your day?
No, I thank you, Madam Chair. And to your comment, Senator Rosen, that it's a moving target, I appreciate that. This pandemic is unfolding every day with a new aspect, and we are working hard to stay on top of it and to try and stay ahead of it and to understand the approaches that other states are taking that have been successful or not successful, and how we may pivot our actions to be more effective. And so things are changing day to day. I appreciate that, and trying to do our best to keep you all informed.
Thank you. And I see Lisa is on, so we'll look forward to having a summary of sources for funds for any contract that you intend to sign, both the IT and the managing personnel. That will be important. And I appreciate you making time to inform us on that today. So thank you. And seeing nothing further, Commissioner, thank you. We will be in touch. Mr. Huff, welcome to the committee. Or welcome back.
Good morning. Let's maybe start my video. Good morning, Madam Chair and committee members. My name is Dan Huff. I'm an assistant commissioner with MDH. Madam Chair, would you like me to maybe cover some opening remarks to address some of the questions that were raised earlier, or would you like just to starting with questions?
Let's start with brief opening comments. I know Senator Nelson and Senator Abler have specific questions, so I'm going to put them right on my list. So go ahead, Mr. Huff, and now Senator Kiffmeyer has her hand up. So we do have 3 questions. So brief comments. We are going to try to wrap by really close to 10. So
Great. Well, thank you. And I know that there's a keen interest in how we protect private data and what we do with private data. We at MDH are governed by the Minnesota Health Records Act, which is a very protective law about how we use and don't use private health data. So we take that very seriously. When we have someone tested at a healthcare provider, say a doctor, we receive positive test results back to the agency. And the information that we get are the demographic information on that person, what's their address, what's their name, what's their phone number, race, gender, et cetera. We also, find out what their result was, what the lab was, some of the more technical information on the lab test itself, what the facility was, and we get next of kin information in case the person is incapacitated or we need to be able to follow up if they're a minor, et cetera. That's the information that we receive. It's stored in our electronic database that has a limited access. I do not have access to that information, only those with the business needs, with the controlled access within the staff at MDH. As you know, the healthcare is governed by HIPAA, and then we're covered, as I mentioned, by the Minnesota Health Records Act. We then use that information that we have to call people as part of contact tracing. And we call folks to ask, who have you been in close contact with? We say to stay home for 14 days or until you're 14 days plus no longer symptomatic. What services do you need to stay home? Do you need food? Do you need medication or medical care? What other needs do you have? Do you have a safe place to stay? Those kind of things to make sure that someone's needs are met while they isolate. And then we ask them about their contacts, and then we follow up on those contacts. Now, these are not, I saw somebody on the street or brushed against somebody in the grocery store, but rather someone we've been in contact less than 6 feet for more than 30 minutes. And we call those folks, and we don't disclose the information. We don't say who we're talking about, but we say you've been in contact with someone who's tested positive for COVID, and we ask you to quarantine. We talk about what that means. And we do the same thing. We ask, what do you need? Do you need food? Do you need medications, medical service? What do you need? Can you stay in a safe place? So with that brief introduction, I'll then be able to answer your questions. Thank you.
great. So I've got Senator Nelson, Abler, Kiffmeyer, and Franzen. Let's start with Senator Nelson. If you could turn on your video and unmute. Thank you, Senator Nelson.
Oh, thank you, Madam Chair. And I'm very glad we're holding this hearing today. I think this is so important. And some of the questions were answered with the commissioner and Mr. Huff. But so we've talked a bit about the privacy in the Minnesota Health Records Act, protecting privacy. And we've talked about the fact that it's voluntary. I think that's an important piece to know. And Minnesotans do step up and most often do the right thing for public health. But the thing that I think is critically important that we haven't addressed so far is, why is this contact tracing so important? How is this going to stop the spread? Minnesotans stood up. We stopped the spread. We stayed home. The economy was stalled. It's going to be a trick to get it up and running again. It's very important. And yet, I think the piece that is missing in the discussion is the importance of the contact tracing with all of the safety measures that we have spoken about. And I'm just wondering if you can speak to that, and then I'll have one other question along that line for you next. Thank you.
Thank you, Mr. Huff.
Madam Chair, Senator Nelson. So I think it really gets to what's the strategy that we have to control this disease. I would say it's a 4-part strategy. One is we're building capacity within our healthcare system to be able to handle increased patients that are admitted to the hospital as well as ICU. We're looking at mitigation strategies, our Stay Safe Minnesota plans, which you mentioned, social distancing, wearing masks, sanitation protocols, things like that, and including the stay-at-home order that we had to prepare for to help us build the capacity in healthcare. Protect special populations. I know many of you are interested in the work we're doing in long-term care, so a much more aggressive approach in protecting congregate settings and people of populations where you have more people who are high risk. And then it's this contact tracing. So we know that if I'm infected, I will infect between 2 and 8 people on average. So if you think of then, if I infect, say, 4 more people, and each of those people infect 4 people, now it's gone from 5 to 17. Now, if those 16 people infect 4, then it keeps going. And so what we want to do to stop that exponential growth is if I stay home and isolate, then I don't infect anyone. So the purpose of contact tracing is that people stay home when they're sick and their contacts stay home in case they are asymptomatic spreaders. That is, that they don't have any symptoms, but they are still contagious and infected, so that they stay home as well. And what that does is it stops the transmission before it begins to spread. It's a much more targeted approach to preventing disease spread rather than these broad scale measures of staying at home. Staying at home can be very effective, but as you mentioned, it's quite devastating on so many other parts of our society and our economy. So what this does is it allows us to open up, but maintaining this surgical approach to preventing spread right as it starts.
Okay, Senator Nelson.
Oh, thank you, Madam Chair. Well, you've described what I think is the more scalpel approach then in staying at home. It's not that everybody has to stay at home. We've done that. As you said, it was devastating. And so now this is a much more scalpel approach. And so I think that's important to know, along with those privacy protections as well. One concern that I've heard from my constituents is that as we continue to have these broader, more, I wouldn't say sledgehammer, but broader type approaches to stopping the transmission, it may be counterproductive. For example, our community youth sports teams this summer, many of those seasons have stopped in Minnesota, but these sports teams now are going to tournaments in other states. And so I just have to, and I know that's happening. And I know that all of the games now they're not Minnesota games, but they're tournaments in surrounding states. And so my question is, how does that impact then this more surgical approach, which is the contact tracing, when we're actually exporting our people, or our people are choosing to go across state lines to participate in some of these normal things that they're not able to participate in Minnesota. So I don't understand how that contact tracing across state lines. If you're in a baseball stadium in South Dakota for a youth tournament, how do you contact trace all the folks in that stadium and in other states? It seems like it'd be much harder if we're looking at, and of course I live near a border, many of us do. I'd like you to comment a little bit on that piece, please.
Mr. Huff, and then we'll go to Senator Abler.
Madam Chair, Senator Nelson, it's a great question. I think it's one of the challenges we have, and that there's not a coherent national strategy on dealing with COVID. So we are taking more of a state-by-state approach, and that is a challenge for us. What we do is we will only follow up with Minnesota residents. So if we have for your example, if we have a kids softball team that goes to South Dakota and the coach catches COVID there in our interview and they're back in Minnesota, we would find that out and we would notify South Dakota Public Health so that they can follow up with other people that were in contact with that coach that maybe lived in South Dakota, but then we would follow up with those contacts within Minnesota.
Okay, thank you. Senator Abler.
So I'm at Menards buying flowers. Anyway, so just a question about what people are concerned with the restaurants. There is fairly good scuttlebutt that the reason that there's reservations is so that the department and the state can collect those names in case they discover there's an outbreak. Mr. Huff, I presume that's preposterous. And if we call it preposterous in the beginning, then maybe it'll never happen. But can you comment about that, please?
Mr. Huff?
Madam Chair, Senator Abler, are you referring to the guidance that asks for reservations at restaurants?
Yes, Mr. Huff, yes.
Okay. Thank you for that clarification, Madam Chair, Senator Abler. We are asking people to make reservations for restaurants in order to control the flow. We don't want just a lot of people waiting outside, congregating, or a lot of people coming in and out of the door at the same time. The idea is, you're making an appointment, basically. I'm going to come at this time, I can go get seated, and that limits the social interaction. Now, when we have a foodborne illness outbreak, what we do is we always call the restaurant and we say, hey, I think we have a foodborne illness outbreak at your restaurant. Can you share us your guest list? Will you share us your credit card list? And that's voluntary. And most restaurants do, because then what that allows us to do is then call folks and say, hey, do you have these symptoms? Just so you know, someone, other people at this restaurant were exposed to this. That's important health information to get to people, because we want to make sure if I've been exposed to a virus that can be deadly, I want to know that. I want to know so that I don't, interact at all with my in-laws who are elderly and at high risk. I want to make sure that I protect my family and my loved ones. So it's important for me to know if I've been in contact with someone. Now, the purpose of asking restaurants to do a reservation is not so that we can somehow swoop in and grab that list. It's really about controlling, having people make an appointment when they come in the restaurant. If we have an outbreak, we do ask for that information. It's voluntary for the restaurant to provide it, but that allows us to contact people who might have been exposed.
Thank you, Mr. Huff, and we're going to keep moving. Senator Kiffmeyer.
Madam Chair, I just wanted to say that I just wasn't reassured by that at all. People have an expectation of privacy when they go out, and
right.
I'm really frightened by what the answer was. I think that's totally a problem. Thank you.
Yep. I think it was vague. There will be follow-up, but I'm going to go to Senator Kiffmeyer and then Senator Franzen. They are the last on my list. Thank you. Senator Kiffmeyer.
Thank you, Madam Chair. And I will echo in also Senator Abler's concern. It seems to me a name and a phone number, which is common with reservations. Getting the address gets very touchy, very personal, very quickly. If the issue is to contact for the purposes you state, then it seems like an address would not be required. On to my question. In particular, we know that right now in Minnesota, 82% of our deaths are coming out of nursing homes, congregate living, those kinds of settings. And so my question for you is, in prioritizing this testing and contact tracing, what are you doing in regards to our nursing homes that are really in a severe situation right now, higher than any other state in the country? This seems like the first place to go to protect and take care of things. Could you address that issue?
Mr. Huff?
Madam Chair, Senator Kiffmeyer. Yes, so early on in our very first actions during this pandemic, Governor Walz ordered the limitation of visitors to nursing homes and our long-term care facilities, because we know this is the highest, this is probably it's the highest risk population, and they're in congregate settings. So as long as we prevent the virus from coming into the congregate setting is safe. What we are now doing is we have ramped up our testing strategy so that if we have one person, a staff person or a resident who tests positive, or if we have two people with symptoms, we test every resident and every staff person. Now, testing is always voluntary. We don't force anyone to be tested, but people generally want to be tested. And we have ramped this up to we are now testing thousands and have tested thousands of people in nursing homes just in the last week. We're using existing relationships with healthcare as well as the National Guard to assist with this ramped up testing. Because as you mentioned, this is a very high risk place, and we want to make sure it is as safe as possible for the residents. It's also one of the reasons that it's important that even healthy people or young people are not exposed to the disease, and that's because they work in these settings. The disease is brought in by staff inadvertently. It's one of the reasons that broad contact tracing is so important, is so that someone who may work at a long-term care setting is notified if they've been in contact with someone who's positive for the disease.
Madam Chair, yeah, I just want to follow up with that. I appreciate last week and this week what you're saying in the thousands. However, this was highly known that elderly, especially with comorbidity, such as diabetes, other things, were highly vulnerable to this. And while the nursing homes were definitely in a stay home and no contact and all that, their employees and others, sadly, yes, we're in this situation, but it seems like the very, very first, not last week or this week, now we have 82% of our deaths, nearly 82%, are in that situation, and now we're pouring it on. But it seems like 2 months ago might have been the time to do so, especially where we stand out across the country as the highest state. So it's just really sad that we knew this. There are other things we didn't know, but one thing we did know was that. So I'm just going to express that now we are dealing with it, but it seems like a bit late. And I appreciate things being done now, but it seems like 2 months ago, this might have been a better decision to have focused on that. So I know that in Senator Housley's committee hearing next week, there'll be more details, but I'm asking it now. So you might get an idea and maybe give us a little more, be prepared to give us even more information. Thank you.
Thank you, Senator Kiffmeyer. Senator Franzen.
Thank you, Madam Chair, and thank you. I want to end on a positive note because I want to thank the department for the work that they've been doing. I think hearing Deputy Commissioner Huff nonchalantly saying that we don't have a coherent national strategy for dealing with COVID-19 is scary. But it's part of why I think, to Senator Kiffmeyer's point, we've failed on many levels. And we're probably going to go back, and I'm sure we are, reporting every single pinpoint data point of this pandemic after the fact. But we are living COVID-19, which is a moving target. And I want to thank the efforts. I want to thank the department and others who were working this weekend to do extra testing for free for people over the weekend, different armories around the state. I believe it was around 7,000 tests that were going through. And I want to tell the people who are watching this committee and the public, that we need to instill public trust in our Department of Health, in our government, especially a day like today. I'm pretty shaken about what's going on outside right now in our communities in the Twin Cities. If you haven't watched the news, you're not paying attention. We need to instill trust. I'm not saying we're going to have rubber stamps on funding for things that we can't afford. I think the questions that have been brought up today are very fair game. We are going to be in a deficit. We already are. And the government at the federal level has given us an arbitrary deadline to spend funds for ending this pandemic, which we know for a fact is not going to end on December 31st, 2020. So I want to make sure that we are careful how we talk about things, because the public is watching now more than ever. And I don't think at least my opinion and my perception as I heard the testimony from both Commissioner Kelly and Deputy Commissioner Huff about contact tracing. We don't mandate vaccines, we don't mandate testing, and we don't mandate contact tracing. This is a tool in the toolbox that we have, and we have to put the resources at our disposal first, because this is about saving lives. And I think the data piece is important. I know that you talked about addresses, names, phone numbers, race, gender. We have bad data of who is being disproportionately affected by COVID-19. We know that. So it's important that we safeguard that data, that the public knows and is reassured that this data will not be used to harm you, but to save you, to save lives. And I think people need to hear that from all of us as leaders, because it's a tough job, not only to be in the position of Minnesota Department of Health, but as legislators that we have to make the decisions of funding these tools. So I just want to make sure that people know this is not a conspiracy theory to get your data and run with it. This is to inform our public policy decisions of where the funding is needed, where the resources are needed. And we know, yes, we knew that the long-term care facilities were high targets. And I remember when they were telling us not to go visit our friends and family in long-term care setting. That was one of the first things that the governor announced. We didn't have good testing for a long time. I don't think that's the governor's fault. And I'm not here to point fingers. I'm just here to say, let's talk and make sure that we know our audience. This is Minnesotans needing us as leaders to find solutions, to instill trust in the public in a time where we are really anxious. So I just want to put that out there, that we're listening. I hear my colleagues. I'm willing to work with all of you to find solutions, but let's not point fingers, and let's find solutions together, because the public expects that of us. And this contact tracing thing, I will tell you again that I'm still learning. And whether it's good or bad, I think we are still, like I said, this is a moving target, and we need to be flexible and nimble, and put the public's health at first and foremost and as our priority, as we continue to spend funding from COVID-19 and as we keep Minnesotans safe in the public. Thank you.
Thank you, Senator Franson. And with regard to lack of national strategy, Florida did prioritize long-term care facilities before Minnesota did. So we're learning from other states, and we're going to get better. For example, I know Texas, within 1 week, stood up their contact tracing software. Indiana, Kentucky did the same. I had a phone call with Commissioner Kelly on May 5th, and we still don't have the software set up. So I think we are learning from other states. In some ways we're ahead. We are fortunate we have Mayo Clinic and University who are willing to step up and help us. But we lost traction from early successes, and it's time to get that back. Mr. Huff, Senator Franson raises an important point about trust. Is it the governor's intention to share this data with law enforcement? I know that was unprecedented. It is not something we had done before. Epidemiology stayed separate from law enforcement. So, Mr. Huff, will the governor be sharing tracing data with law enforcement?
Madam Chair, Executive Order 2034 directed the Department of Health to work with the Department of Public Safety to provide information in order to protect our first responders. It's a difficult balance between we want to make sure that our first responders are safe, and the best way to do that would be that every first responder has the necessary PPE. And while We have been working very diligently to purchase PPE. We know that nationally there are shortages and continue to be. So the balance is, how do we ensure protecting our first responders and protecting individuals' rights of privacy?
So, Mr. Huff, law enforcement doesn't have appropriate protection and they conserve PPE. They don't use protection. They don't use PPE when they go to a house where there's not COVID noticed? Or how are we conserving PPE through this notification process?
Madam Chair, the process is dispatch has the addresses for those who opt in to share their address. So when we call someone who is infected, we give a Tennessean warning, and we say how this information will be shared with the Department of Public Safety and with dispatch.
Mr. Huff, is there a different protection, different personal protective equipment standard for addresses where there isn't COVID reported versus where there is COVID reported?
So
because the only way we conserve PPE is if there's different practices. And so we're not going to get into this. I'll talk to Commissioner Harrington about it. I don't want our law enforcement to go without personal protective equipment. Our nurses are having to conserve. Our healthcare facilities are all having to conserve. But sharing this with law enforcement is still a problem for a number of people. If it's about public health, then let's make sure law enforcement has the protection they need and that they act on that. So I'm going to go to Senator Jensen, then we're going to wrap up. Senator Jensen, we're going to try to end at 10, so we're a little over.
Thank you, Madam Chair, and thank you, sir, for your testimony. I really appreciate Senator Benson's line of questioning, because in a situation where we know that for every confirmed laboratory test, there's at least another probable 10 to 100. I mean, you look at the Santa Clara data, you're looking at 50 to 85, whatever. We know that there's far more cases of COVID-19 that haven't been identified than have. And I worry, as a previous medical director of emergency room, that we are sending first responders to homes, having potentially lulled them into thinking that this is a safe place versus one that isn't a safe place. And that just makes no sense to me. I think Senator Benson hits it right on the head. Personal protective equipment has to be used in every situation. The first step would be the N95 mask being on the patient and the provider, the responder, if you will. But I have grave concerns about disseminating this personal health information when, quite frankly, one of its potential outcomes would be lulling first responders into putting themselves in harm's way unnecessarily. Thank you, Senator Benson.
Thank you. And Mr. Huff, I'll take that up with Commissioner Harrington as to why we would have our first responders have a lower standard of personal protection. And with that, Mr. Huff, I'm going to review the governor's emergency order. If the guidance is inclusive in an emergency order, I think a lot of people feel that it's mandatory. So your representation that reservations are optional and voluntary, if it's included within an executive order, I don't think people feel that that's voluntary. Executive orders have the force of law. And one of the things that is significantly lacking in the executive orders is a clear delineation of the consequences of violating an executive order. And so I'll be reviewing the executive order to see if the reservations guidance was inclusive in the executive order. And then I'll follow up with you as to whether or not an executive order is actually contains voluntary components. With that, members, we don't have anything else planned for the near future. I would urge you to review Minnesota statutes 144.419. That's our quarantine law. It does talk a lot about voluntary and minimal essential enforcement. I also sent you the federal funds request. There's some good news. We are starting to do serologic testing so we get a better idea of the virus and its presence. and keep an eye on how we are spending those federal funds. Generally, they are in line with where I think this committee has our priorities. We just have this overview or oversight responsibility for the department as a whole. And if they make a commitment that we're going to be expected to follow up on, I think we're going to face some pretty serious challenges. And with that, I see people with hands up who've had the chance to ask questions. So we're going to take those offline, and you can follow up with commissioners on your own. I appreciate that, members. I wish you peace this day. Last night and the night before were certainly challenging times for our state, and in particular Minneapolis. And I see Senator Klein is here, and he had been with Senator Hayden present during a press conference. So I look forward to hearing Senator Hayden's comments and to see what is next for the city of Minneapolis and the residents there who are going through historic strife. And so thank you, members. And with that, we are adjourned.